Now, if you are going to decide how to buy a new car, you already have criteria in your mind. Do I want a minivan, a sedan, an SUV? What price range do I want? Do I need to have the fancy electronics, the upgrades, the leather seats, or not? You've got ideas in your mind about how to choose and what criteria you're going to use to buy. When it comes to deciding on whether your child should take medication, you don't really have criteria to decide. And it's an overwhelming decision. And you feel pressure both on yourself, for your child's future, and pressure from other family and other people who may be judgmental. It's a very difficult thing. So I want to give you 2 ways to think about whether you should take medication or continue with medication. So the first thing is to balance risk-benefit ratio. What I mean by this is, what are the risks versus what are the benefits? So most of the time with ADHD medication, there's about an 80% chance that they're going to work and about a 10 to 15% chance there are going to be side effects of concern. Pretty good odds, right? So balancing risks and benefits, it seems reasonable to try the medication. If your child ends up being with lots of side effects and minimal benefit, well, now the risk-benefit ratio is the other way. Better stop it. Either try something different or stop it, right? But if your child ends up getting mostly benefit and almost no side effects, which the odds are in that favor, then it's probably worth doing it. The other thing is to remember the flip side of the risk-benefit ratio, which is what are the risks if they don't get treatment? You know what's going on now. What will happen if that keeps on going on for another 1 year, 2 years, 5 years? Where will things be? How are the risks going to be versus the benefits? So that's one way to think about it. The other way to think about it is impairment. I mentioned this when it came to the diagnosis. So oftentimes I'll talk to parents, where is your child functioning now versus what they're capable of? And most parents know their child is capable of more because they can see their child's intelligence and capabilities and everything else. But they've got this impairment there. And then the question is, if you take that impairment and you move it over time, what does that look like 2 years or 5 years from now? If there's significant impairment, it's worth trying treatment like medication. If there's not really very much impairment, then maybe you don't need to use medication. And I said if there's no impairment, then it really doesn't make the diagnosis of ADHD anyway. So think about it from that perspective.